I think what we're going to do today is I'm going to start out by showing you a short video here that was done a few short years ago that really sums up my sentiments on a very tragic medication error that occurred with my daughter back in 2006, Emily Jerry. My daughter was miraculously cured by modern-day medicine. She had been diagnosed just 5 months earlier with a grapefruit-sized mass in her abdomen that after 5 short months of chemotherapy had completely disappeared. And on the day that I was supposed to bring my baby girl home, very last day of treatment, and move on as a family, there was a tragic medication error that occurred that took Emily's life. And ever since then, my work has been all about bringing things forward, learning from what happened to my daughter, and learning from what happened to others, so that we can prevent these types of tragic medication errors from happening. Medication errors, preventable medical error rather, has been identified as being the third leading cause of death in the United States. Third leading cause of death in the United States. One of my friends, Dr. John James, identified the number of lives lost here in the United States alone as being over 440,000 lives lost every year, American lives, to preventable medical error. Another gentleman that was just featured in the Fox documentary that I just did most recently, hosted by Bill Hemmer, Dr. Martin Macri from Johns Hopkins, put the number at 251,000 lives lost every year. It's still astounding that we're losing that many lives, and that's why I'm so honored, truly honored. Everybody keeps thanking me for coming here today. I'm honored to be here in front of all of you. All of you have, on every level, whether you're in manufacturing for Omnicell, whether you're in administration, each and every one of you has such an important job, because really at the end of the day, the technology that's being developed here and the existing technology you've already developed is preventing tragedies like what happened with my daughter from happening again. So we're going to watch this short video, and I'll be back to talk to you about it in a moment. Thank you. My daughter, Emily Christine Jerry, was born February 24th of 2004. She was playing in the backyard with her brother and sister, Nate and Catherine, and I noticed that every so often Emily would stop and grab her side and wince. After witnessing this occur 3 or 4 times during the course of the afternoon, neither one of us as parents really thought much of it, but we knew that we needed to take her in to have her checked out. We took Emily to a leading pediatric facility in Cleveland, Ohio, and they had decided to run Emily through the MRI scanner. And there was a grapefruit-sized mass in Emily's abdomen. They prepared us to expect the worst. They set our expectations, expect that your little girl is going to lose a significant amount of weight during the course of treatment. She's going to lose her beautiful blonde ringlets. She'd be vomiting, most likely, and things of that nature. She didn't start losing those beautiful blonde ringlets of hair until January of 2006. But I knew in the back of my mind that quite possibly the tumor wasn't responding to that course of treatment. So the decision was made to run Emily through the MRI scanner again. Emily's tumor had completely disappeared. There wasn't even any residual scar tissue remaining in her abdomen that they had anticipated. A miracle had occurred. And those are the caregiver's words, not mine. At this point, they recommended one final 3-day round of chemotherapy, just to make sure that there wasn't any residual cancer cells remaining. I arrived about 10 or 15 minutes after they had started Emily's IV that day. And when I walked into Emily's treatment room, Emily was unconscious. I was thinking to myself, how could this have happened? I mean, she was just fine. What was found to have happened was the clinical pharmacy that day ran out of standard bags of saline with 0.9% sodium chloride. And so this young pharmacy technician decided to take an empty compounding bag, and she saw 3 vials of what's called hypertonic saline, which is 23.4% in concentration. She filled this empty compounding bag with those 3 vials of hypertonic saline and used that as the base solution for Emily's chemotherapy that day. She thought she was doing the right thing. That Wednesday was when my wife and I had to make the most difficult decision of our lives, which was, after multiple EEGs showed little to no brain activity, the decision was made to take Emily off of life support. That day is still a blur to me emotionally. I was packing some of Emily's things from her treatment room into the back of our SUV, which happened to be parked on the top floor of the parking garage at the facility that day. And I saw the car seat in the back of that SUV, and I was thinking, you know, maybe I should just take a flying leap off this parking garage and go and join my little girl. I'd never had those kind of thoughts or feelings before in my life. And it was almost at that moment that I decided to embark on this career. I don't want to say that it was chosen, that I chose it. I believe it was chosen for me. And worked so passionately on through my advocacy efforts to try to find or be an active part of the solution to preventable medical errors. And so in striving to be part of the solution, I've been working very hard through the programming of the Emily Jerry Foundation. I believe that we can get to 0 deaths in the United States from preventable medical errors, because they're just that, preventable.
I've seen that video probably more than 100 times, and it still gets me. And a lot of people will ask me, especially when I'm one-on-one, a lot of my friends and colleagues that I work with around the nation will ask me, well, Chris, when you were on that parking garage, weren't you mad as hell at the medical facility? At the clinicians that let your daughter down? I refer to clinicians as caregivers because that's what they are. You know what the honest answer to that question is? No. What gets lost in Emily's tragic story sometimes is the fact that it was modern day medicine and the wonderful care that she received from all of these clinicians. The nurses loved my little girl up like she was their own. And I think that's what helped cure her. Nobody meant for this to happen. And people say, well, Chris, I don't think I would respond that way. Where does that come from? I think it comes from the fact that what you didn't hear in that video was that horrible day, that Sunday, February 26th, when the error occurred. all of us together wheeled Emily down to the PICU, and the doctors were trying to stabilize her. And I was thinking to myself, this is not rocket science. This is not rocket science. It had to be something to do with my daughter's IV mixture. It had to be. She was just fine. Before that, all throughout her treatment, she was fine. And I went back to Emily's treatment room on the same floor while the doctors were stabilizing her, and I actually dug through the trash and found the partially full bag. And I had the nurse who was with me, helping me, call down for an administrator, and I handed it off to the administrator, and I said, I really think this is where you need to start your root cause analysis. My point is, I think it was because of that, those facts, the amazing care that my little girl received, the outcome that almost was realized, is why I was not angry. I can only explain that as being a miracle, me skipping over the natural second stage of grieving, which is anger. But then my thoughts started going immediately. I knew that there was no bringing my little girl back to this earth. My major concern, the day we took Emily off of life support, I was bound and determined to focus on where did the systems, processes, and protocols break down that allowed these wonderful clinicians who took amazing care of my daughter all throughout her care, what set them up to fail? I needed to find out those details. And this work has become a full-time job for me, one that I'm very passionate about. I feel like this is my calling. And this is why, this goes back to what I opened up with when when Jorge first introduced me. This is why I respect each and every person with Omnicell that's sitting in this room right now. You're all focused on developing these solutions that are preventing these tragedies from happening. You'll never know how many tragedies they're preventing, but I can stand here right now and tell you honestly that had they had Omnicell equipment integrated into the pharmacy, if they had had simple barcoding, my little girl, Emily, would still be with us today. That's a fact. And that's why I know, in our work lives, we all have bad days. Where we're working hard and everything just doesn't seem to be going right. And you get a little frustrated. Maybe you get frustrated with a coworker of yours or something, or you have a disagreement. It's kind of like a big family dynamic, right? You're driving home and you're all stressed out. What I want you to do is pause, think about my little girl, and think about the fact that you work for a company that is preventing these types of tragedies from happening. The company you work for is, in effect, saving lives, countless lives. And that's why I'm also so excited and so honored to move the partnership between the Emily Jerry Foundation and Omnicell forward together, because I believe in my lifetime, my audacious goal is I want to see us get to 0 preventable medication errors. I really think we can. I know that's an audacious goal, but I told you that preventable medical errors are now the 3rd leading cause of death in the United States. What I forgot to mention was medication errors are the largest percentage of those deaths. 43%, as high as 43% is what I've heard. And so how are we going to get to 0? And why do all of these errors occur in the first place? Is it because we have bad people working in the pharmacy? Is it because we have bad clinicians? No, definitely not. It's because of the human error component in medicine. The fact that we're all fallible. We're all capable of making a decimal point error if we're doing manual calculations. We're all capable of human error. I've given a lot of, in the past 7 years, I've given hundreds of lectures and presentations at different medical facilities around the nation, at medical conferences and things like that. And in my lectures, when you pull back all the layers, I believe the way we solve this problem is there's two ways. I believe it's through the smart implementation and adoption of technology in medicine as the tools that all of you are involved with developing and manufacturing and distributing. Those are the tools. But they must be coupled with new and improved and ever-evolving best practices by the individual modalities. And the equipment that you all manufacture has clinically proven efficacy to reduce that human error component that leads to all of these tragedies from occurring. And me being the biased, proud father, I think my little girl looked like an angel even before she became one. But I want you to all to remember, too, that the reason for the guardian angel logo with the likeness of Emily is not just because her daddy thinks she's his guardian angel. I know she is, and I don't mean that arrogantly. But I want you to know I believe Emily's all of your guardian angels, too. I really believe that. And my biggest concern became, after Emily's passing, making absolutely certain that I was being more than just a grieving father with a horribly emotionally traumatizing story to share with everybody and then I leave. I've always wanted to be part of the solution and prevent other babies and children, other families, and for all of us to be safer when we're receiving health care. And EJF's core mission is to eradicate medication errors. In meeting with and talking with great people like Dennis and John here and Jorge, your mission is almost identical to the Emily Jerry Foundation's. I think it is identical. I really do. And, the core focus to make the medical facility safer for everyone, beginning with the babies and children. To focus on raising awareness of this problem. Many people aren't even aware that preventable medical errors are the third leading cause of death in the United States, and they're certainly not aware that medication errors are affecting so many people. And as I mentioned before, to be an active part of the solution, finding ways to minimize the human error component in medicine. These are the tools that all of you have already worked so hard to develop and implement. And through that, all of us here are really devoted to saving lives each and every day. So when we've had a really stressful, bad day where things didn't seem to go right, just think about that for a moment. Not too many people, not too many of your friends or family members that are working in other areas can honestly say that, hey, my job's about saving lives. And I already discussed that, my core focus whenever I'm lecturing or presenting anywhere, my focus is to take away the blame game and the finger pointing that goes on when a tragic event like this occurs, pointing fingers at different clinicians that clearly weren't responsible, and focusing on the systems, processes, and protocols in medicine. And I refer to clinicians as caregivers. Some people say that that's not correct, but I believe it is because it's exactly what they are. And many of them have shared the same fear. Nobody wants anything. If you're a clinician, you don't want anything bad to happen on your watch. And again, that's what your technology and your equipment does. Your technology also lowers the probability of this human error. And by implementing technology like yours in all of our facilities, that's what I want to strive for with our partnership together. I want to strive to make the technology that Omnicell has developed here, the life-saving technology, I want to make it become a standard of care for the medical facilities. I don't want your equipment to be optional. I want it to be required. Just like fire extinguishers are required by OSHA on any manufacturing line so many feet apart. If a facility is compounding IV medications, as most all of them do, I want it to be a requirement that they have technology that if it's not Omnicell's, it is very, very similar. It's a requirement. It is the standard. And, I find this, ingraining proven processes, I find it very amazing. What gives me great hope that we can reach my audacious goal? These iPhones that we all know and love so much. I kind of have a love-hate relationship with mine, but pretty advanced item to manufacture. With the high-resolution screen and the processors and all of that kind of stuff, right? How is it that Apple, somewhere over in China somewhere, they're able to manufacture iPhones, millions of them, and iPads and things like that with what's called zero defect manufacturing? They've done that through the implementation of things like many of you that are here from your manufacturing facility know this, through the implementation of things like ISO standards. We're all familiar with that. Things like Six Sigma principles, things that have been borrowed from lean manufacturing, the Toyota model, things of that nature. That's what makes me so hopeful. That's what gets me out of bed each and every day around 5:30. I know that sounds pretty twisted, but that's what gives me hope. It's what gives me passion is that, if they can do that with these little gadgets that we know and love so much, I know each of us as patients, they're very complex. Each person's condition, disease states, and treatment is very complex. But it can't be that much more complex than the iPhones. So if they can get to zero, I believe we can all get to zero together. And we can make things safer in medicine for all of us. And this is where the partnership that we're developing here today with Omnicell, I believe Omnicell as a partner can really help lead this effort. I don't just believe that, I know that already by the way today's meetings went. And having a chance to really visit your lab and see this equipment in action. We've got some amazing demonstrations and things like that. So I know I'm a little bit limited here on time. I really believe this. Today's technology really can prevent tomorrow's tragedies. So I want to encourage all of you to continue your vital work here and continue developing this technology. Continue to all do your part to bring this technology forward for all of us so we can make all of our babies and children and family members and ourselves safer. We live in a very exciting time in medicine now where the medical community, we're curing different forms of cancer, other diseases, so on and so forth. And if we can hone in on this now and start saving more lives and get closer to zero, this is something that touches all of us and all of our families, and let's all rally together and bring it all together. And these are just some of our initiatives and programs that we have already put together and have been implemented at various levels. One of the ones that I'm most excited about in working with Omnicell on is the Pediatric Safe Label Program. Body weight is a significant issue with the pediatric and neonate patients. You know, the dosage and concentration you give a 60-pound patient, 60-pound child, you certainly, if you gave that same dosage and concentration to a 20-pound patient, you're going to have dire consequences, right? So the basic idea or premise behind the Pediatric Safe Label Program is any medication that's being prepared for a baby or a child will now have the blue guardian angel logo printed on that medication label as a gentle reminder to everyone that comes in contact at the facility with that medication, whether it be the pharmacy tech that might have compounded the IV because they didn't have your wonderful equipment. We'll see that label. The nurse or nurses that administer those medications, just as a gentle reminder to double check, triple check, quadruple check dosage and concentration. And I believe it's already saving lives, and I believe it's going to continue to. And we've already been talking about ways in which we might be able to implement that program with the Omnicell IV compounding equipment. So I'm so thankful. But bottom line is I want all of you to realize that I believe by all of us truly working together, and I always like to use the word whether it's right or wrong, with all of us rallying together, I believe that both of our organizations can truly accomplish our missions together. So thank you very much. I've been so honored to be invited here and to be speaking before all of you. I'm really thankful. Thank you.